Now we will be having Dr. Sayyid Mohamed Almoosawi, graduated of RCSI, Medical University of Bahrain in 2011, currently a resident at the ENT, Head and Neck Surgery Department in Salmania Medical Complex, and part of the cochlear implant team in SMC. Holds the membership of the Royal College of Surgeons in Ireland in ENT, MRCS ENT, member of the Bahrain ENT Society, and won many honorary awards. Thank you.
Thank you, Hassan. So I need to share my presentation. So good afternoon, everyone. I think it's a very good chance and opportunity for all you students and whoever is following this career day to have such an opportunity to have an idea of what's coming ahead. Many of us did not have the chance to experience such a thing. So before we start, I would like to thank Dr. Khalid Al-Ohali, the president of AGU, Dr. Haifa, Dr. Salman Zayani, the organizing committee, Hassan Musawi, my little brother, Aisha, Haja, Abdullah, Nawaf, Jaber, and Faisal. You guys are doing tremendous work. So thank you for that.
Pleasure. It's a pleasure, brother.
Okay, so my presentation is going to talk about ENT, okay, the otolaryngology head and neck surgery specialty. Hopefully I can give you guys a look ahead of what's going on, what you're gonna experience, and what is ENT. And I'm gonna specifically talk about the Arab board program of ENT because I'm doing my residency program in Salmania. Okay, so I'm a graduate of RCSI Bahrain, okay? I am doing my residency currently in Salmania Medical Center. I'm interested in clinical teaching especially. And today I'm going to talk about the ENT specialty and the Arab board program. So what's special about ENT? So ENT is a specialty that I choose because it has both a surgical part of it and there is also a medical part of it. Surgical part, doing surgery in the ear and the nose and the throat, and also managing medical problems, hearing loss, allergies, okay, chronic diseases that are related to the ENT specialty. So not all ENT is just surgery and not all of it is medical. And another fine thing about ENT is that it goes through all the ages, through neonates to elderly, where you can experience having the pediatric ages where they are born, when you follow them up, because in suspected cases of hearing loss, for example, you guys need to know that this neonate has hearing loss or has a problem with hearing before he starts learning, before he starts going into the ages where he should start speaking. Because if you cannot hear, you cannot speak. We all know that. So it also ranges to the ages of the elderly. And it deals with all the diseases of the ear, of the nose, of the throat, of the skull base. And it deals also with benign and malignant neoplasms of the head and neck. Okay. So all this as part of the ENT specialty. And ENT specialty is actually sub-specialized into these categories. There are people who go into specializing in the head and neck surgery, where they are concerned with the oncological cases. Okay, there are people who go into the facial plastics, reconstructive surgery of the face and neck. Okay, you can specialize in the ear. You would call that otology and neuro-otology. You can specialize in the nose, rhinology, dealing with the sinuses and anterior skull-based surgery. You can specialize with your voice box, okay? So that specialty is called the laryngology. You deal with voice disorders, and you can also specialize in the pediatric ages, having congenital malformations and so on. There is a sleep medicine subspecialty, and there is also a specialty that is away a little bit from the surgery, which is the audiovestibular medicine, which deals with the vestibule, which is the organ of balance. So all these patients who have dizziness, or those patients who have problems with their hearing, this is the specialty that deals with those cases. So journey of ENT specialty in SMC. Okay, so if you guys are interested in ENT, so you guys have to bear in mind this, that ENT is a subspecialty that is very competitive. It's competitive, it's highly competitive all over the world. Okay, you have first to graduate with your medical degrees, that is the MD for AGU graduates. Then you do your internship year, and then you go into the Salmania. We have the third specialty interviews where you choose your wanted specialties, and through the interviews they would seek your interest, they would look at your CV, they will look at your personality wise. It's very important that you guys are ahead in research. They would look at your marks, they would look at also recommendation letters. So I would advise, whenever you finish your rotations, please ask the tutors who helped you in your rotations to give you recommendation letters, okay? And then nowadays there are pre-entrance exams that also help in choosing the specialty. Okay, so after you get chosen into ENT, there is for Salmania, there is the training program that is the Arab board. Okay, so you do your specialty exams and you get graduated with the Arab board specialty in ENT. And what is this Arab board program? It is a 5-year training program. So there are other programs like the Saudi board, like the American board, okay, and so on. But I'm going to focus on the Arab board because I'm involved with the Arab board. So this is a 5-year training program. The first year, you guys are away from the ENT specialty. You do your general surgery, you do your ICU rotations, your neurosurgery, your plastic surgery. And then once you come, then you are involved in 4 years of specialized training in ENT, okay? And your training is doing surgery, going to surgical courses, doing research, fulfilling your logbooks and updating them with the latest procedures and cases you have seen, and then doing the rotations in the different subspecialties that we mentioned, okay? Like otology, laryngology, audiovestibular, and so on. So you get exposed to the subspecialties during your rotations. And then they are involved with educational activities like the morning meetings that we have in Salmania, the lecturing, the presentations, morbidity, mortality lectures, journal clubs, and so on. So there's a continuous educational program that you guys are involved. And then you end up, after your first year, doing the first part of the Arab board, which is the basic science. It's an MCQ exam, and you guys pass it after you finish. You go ahead and do it after you finish your first year of rotations outside the ENT. And then once you're finished with your 4-year training program, you do the Arab board part 2, which consists now of both an MCQ and a clinical, or we call it the OSCE exam. And then once you finish and you graduated passing those exams, you are an Arab board certified, okay? And there's the link for their website for you guys, if you guys are interested in seeing it. So these, just to share, these are some of the journey that I had, okay? So on the left, you're gonna see me with my team. We're doing neck surgery on this patient who had cancer of the larynx, okay? On the right side, this is a training course that we did in Saudi, and it's the dissection of the temporal bone, okay? We use that for so many cases, including plantation of the cochlea. Here, we did a course. This is the AGU on the left, okay? We're doing a bronchoscopy course, okay? where we use a registered bronchoscope. So this is the training, the kind of training you guys can be involved in. And we actually have so many achievements done in Salmania. This is one of the achievements that we did, and it's a rare operation that we did for this fellow, and it was in the newspapers and news. Okay, so this is one of the presentations. Okay, this is part of the day of the morning activities that we do. So what does having the Arab board mean for those who are here in Bahrain? Okay, so all the specialties are regulated under NAHRA, okay, the National Health Regulatory Authority. And NAHRA has classified the different boards and put a classification and a scheme for the board. So when you guys graduate as an intern and you finish your internship, you're having your MD certification, you guys are, and you go into the Ent specialty, you guys are called residents or junior residents, okay? And after you guys finish your first year outside Ent and do your first exam, okay? That is the Arab board exam, okay? Or another specialty like the MRCS, MRCP exams, okay? So once you finish those, you are eligible to becoming a senior resident. Later on, if you finish the second part, and it's only if you finish the full part of the Arab board, okay? So completion of that specialty program, finishing part 1 and part 2, you are called a chief resident, okay? And then to become a chief resident, so you guys notice here there are 3 tiers, and the tiers here rank how qualified the training program is. So Arab board is a tier 3, and I'll show you some schedules. And for example, Saudi board is a tier 2. So a tier 2, like the Saudi board, means that you finish your specialty program, you get your certification, and then you have to have 1 year of experience post-qualification, and then you are a chief resident. Okay, hope this is clear. However, you need 3 years if you, for example, have the Arab board to become a chief resident post-qualification. So what's after the chief resident? You guys all want to be consultants, yeah? Okay, so let me just move all the drawings. So you guys all want to be consultants and successful consultants, inshallah. So once you finish your recognized specialty, to become a consultant, if you are part, for example, of the Saudi board, which is tier 2, you guys need 4 years of clinical experience post your qualification, and then you guys are consultants. However, for the Arab board, it's a tier 3, and you cannot attain a consultancy unless you guys have fellowship programs. So this is, I'll show you the link for this document. So this is the Arab board, which is the Arab country. It is, if you finish it, and the specialty for Ent example, it qualifies you to be a part of the tier 3. And all the training programs are listed in this schedule. And for example, the Saudi board is, for the health specialty, is tier 2. So to become a consultant, you need 4 years more experience after you finish your exam to have it. However, the Arab board, you guys need to have a clinical experience fellowship abroad. This is the link for the document, and I think it's an important document. And you guys need to be in the picture, so you guys know how to plan your futures and know how to step forward, okay? So what's the typical day at work? So you go in the morning, you see your inpatients, your post-op patients, what we call the morning rounds. We do the morning departmental activity. Okay, we have some days outpatient clinics. Okay, some of them are generalized, some of them are subspecialized. Okay, and then we have operating days. Okay, and after we finish our clinics, we do afternoon rounds, and also you have your on-call duties. Okay, so you're doing on call. So these are some pictures, okay, showing. This is on the left. You guys see that we're discussing and looking at the films and labs of a patient and discussing what is the best management for that patient. And on the right, sorry, we did an event recently last year before the Corona crisis, in which we tried to raise the awareness of people with hearing programs, and it was in the avenues. So this is the team of ENT. Some of them are here, some of them have retired, and I would like to thank you for this opportunity. I hope I gave you a glimpse, at least, or some fine thing for you guys to think about when you guys choose any of your specialties. Okay, if you guys have any questions, and again you can contact me on my email, or you can contact me through my brother, whatever you guys whatever suits you. Okay.
Thank you so much, Doctor. It was a pleasure having you. If there's anyone having a question, we can open the floor for the questions.
Okay. So I'll go ahead, read. If you guys have any questions, either write them or speak them. So thank you. How many spots are present for? Usually it's between 2 and 4 spots for pneumonia. Previously it was 1 or 2, but now the trend is because there's so many people who are applying for them. So it's usually 2 to 4 spots. Okay. Give example of pre-entrance exams. So this is a general exam. Okay. So they try to make it as fair as possible. So they ask you, just like your MD exam questions. So this is a standardized exam that this hospital put because people come from all over the world to apply for a specialty. They try to put an exam to standardize that standardize the marks and know who has good marks, who is a grade A student, and so on. But it is known for years that AGU have exceptional students and graduates. It is well known among the doctors and the hospital as well. So I thought Arab board is tier 2. No. So to clarify, Arab board is tier 3. The Saudi board is tier 2. Thank you. When would be the 2 parts of the Arab board? So it's a 2 exam. The first exam, you guys finish it after you do your first year outside the ENT specialty in your clinical rotations in the ICU, neurosurgery, plastic surgery, general surgery. Okay. And before you come to ENT, you have completed the first part. This is basic science, anatomy, physiology, and so on. Then the second part is after you finish your full 5 years. So when you come, you finish your 4 years, you are applicable to do the second part, which is first you have to do the MCQ. And once you pass the MCQ, you are eligible to do the OSCE, the clinical exam, and that's it. Okay. How do I know if ENT is a good fit for me? I believe ENT is a specialty that would fit anyone, okay? Because the environment is friendly, it's not, and the material is unique. The subspecialty of it, you can go in so many directions according to what you like and what you need. If you're interested in plastic, you can go for facial plastics. If you're interested and doing big surgery, you can do head and neck, thyroid surgery, cancer surgery. If you're interested in delicate surgery, you can do otology, cochlear implantation. If you're interested in doing in the pediatric, or you guys like the pediatric age, or know how to deal and cope with pediatric levels, you can do pediatric otolaryngology. If you guys decided to go away from any surgical specialty field, there is the sleep medicine, there is the audiovestibular specialty as well.
Thank you, Dr. Said Mohamed. It was a pleasure having you today.
Okay.
Have a nice day, dear.
Okay.
If there's any questions, please, you can bring it up in the chat.
Okay.